Hello, and thank you for joining us for this session, Navigating the Financial Fallout from Cancer. In this session, you will learn options for managing the financial impact of ovarian cancer, how to work with your hospital, and how pharmaceutical patient access programs work. Our speakers for this panel include Emily Gibb, who is currently Senior Director, Public Policy at GlaxoSmithKline, Kevin Knowles, who is the Senior Reimbursement Manager with AstraZeneca Oncology, Joanna Fauzi Morales, who is a cancer rights attorney, author, speaker, and CEO of Triage Cancer, and Bridget Toomey, who is the Assistant Clinical Director for the Department of OBGYN at University of Iowa Healthcare. You can view their full bios in the downloadable conference program. I want to thank our speakers for joining us today, and let's get started.
Well, hello, everyone. It's a great conference, and it's a pleasure to be with you today. I'm really happy to have the opportunity to share some resources that may be beneficial for you if you're navigating a cancer diagnosis. So you've heard a lot of great information already from my fellow panelists. And what I'll share with you today are some of the manufacturer resources that we have at GSK, but also that many other companies have as well. So to get started, the first thing to know is that most manufacturers have some type of assistance program that's usually pretty holistic in what they offer. So for us at GSK, we are sensitive to the out-of-pocket concerns of patients. We want to make sure that you can afford the medication that your doctor or healthcare provider believes is the right one for your cancer diagnosis and for what you need for your treatment. So in order to do that, we operate what's called a hub service. And in a little bit, I'll show you the website where you can go to get additional information for that program. And then also a website that has a lot of different manufacturer programs as well. So in these hub services, we have a dedicated call center. So either you or your provider can call and speak to somebody live. And what they'll do is talk to you a little bit about your specific situation. We know that a cancer diagnosis is very individual for each patient. And so we want to make sure that we're listening to you and understanding the type of insurance coverage that you may have. If you're completely uninsured, we also have options to assist. And we will talk to you about the different ways that we might have some affordability solutions for you. So one of the first things that we would do if you have insurance coverage is do what's called a patient-specific benefit investigation. And that means we can dive a bit more deeply into the type of insurance coverage that you may have to understand if you need to have a prior authorization, to understand what the out-of-pocket cost sharing might be in that plan, to really take a look at what the insurance coverage is. And it's important to distinguish the different types of patient insurance. So some people may have commercial insurance. Some people may have Medicare Part D if it's an oral therapy, or if you need an infused or administered therapy, you might be covered under Medicare Part B as in boy. And as I mentioned, some people are either completely uninsured or significantly underinsured. So what we want to make sure is that we're listening to your specific concerns, and then we're looking more deeply into that type of coverage. If you have commercial insurance, you may be eligible for a copay assistance program. Manufacturers offer these, and there are also independent foundations that also offer these. There's a new statistic that just came out, and in 2019, the average patient received about $1,600 in copay assistance if they were eligible. So that's a significant benefit for patients, and that statistic is across the entire industry, not specific to GSK. We can also look and see if there are any additional resources out there that might be available. As I mentioned, there are independent foundations. There are other entities out there, lots of nonprofits that are really dedicated to helping patients. And we want to make sure that you are aware of those and have the access to them as well. And then finally, if you need a referral to a specialty pharmacy, we do have a pharmacy network. list, and we can help you with that as well. So for patients who may meet the income criteria and you're either completely uninsured or have Medicare, we also offer a charitable patient assistance program. So the Hub team can talk to you about your specific situation. And if you live in the United States, Puerto Rico, or one of the outlying territories, you may be eligible for that charitable assistance. For Medicare patients, you usually will need to meet a bit of a cost-sharing requirement first before qualifying for patient assistance. And our team is ready to talk to you about that and also to walk you through the process. So the website where you would go to get more information is togetherwithgskoncology.com. And there's a home screen here where you can click if you're a patient or a caregiver, or if you're a provider. And then once you get into the site, the information is tailored to your specific needs. Additionally, as I mentioned, a lot of manufacturers have programs. So you may or may not need a GSK medicine. And of course, we are very proud of the medicines that we make, but we recognize there are a number of wonderful treatments out there for patients. And so the Medicines Assistance Tool is a really great resource. And the website for that is mat.org. This website was relaunched just a couple years ago. And no matter what specific medicine you may need, you can put your information in, and then it will tell you what resources are available to you by the manufacturer who makes the medicine. Additionally, there are a number of really good educational tools on this website. So there are questions to ask your provider. There are 4 things to think about as you're navigating the financial responsibilities that may come with a cancer diagnosis. And there's a lot of good information about being a savvy consumer when it comes to shopping for health insurance. So we want to make sure that you're aware of these resources. We hope that they help you. And of course, we wish you best of health going forward.
Thank you so much for the opportunity to be with you today. I'm sure everyone is enjoying the virtual national conference, learning a lot, and for a great call. We follow the science for our medicines, but most importantly, we want to make sure that patients have access to our medications. So today I wanted to take you through a high-level insights into understanding the patient access journey. But first, I need to read just a little bit of the complaint, and that the following education material that I'm getting ready to cover was solicited by either an office or organizations such as OKRA and or an affiliated entity. So what are we going to talk about today? So high-level overview for the agenda, we're going to talk about what is AstraZeneca's Access 360. We're going to also talk about the support team of AstraZeneca that supports patient access programs, healthcare providers, as well as patients. We're going to look at the support offerings, the support resources. We won't go into anything product specific, but I will give you a high overview of our affordability support for patients. And also I'll provide you the Access 360 contact information for those resources. So as I mentioned before, what is Access 360? Access 360 is a personal support resource that helps streamline and reimbursement for select AstraZeneca medications. The way I like to think about it is think of it as a suite of services that assist healthcare providers, caregivers, and most importantly, patients. There are a team of professionals behind the scenes that can help out with affordability, reimbursement, and access for any of our selected medications. So what are our support offerings? Well, Access 360 has a lot of support offerings. As you can see within this grid here, benefit investigations is one aspect. Through our benefit investigation support, we can actually understand prescription coverage for a patient. We can look at out-of-pocket costs. We can also look at pharmacy options. Built in with that is also prior authorization support. As you know, with insurances, we have prior authorization requirements. Through AstraZeneca's Access 360, we can determine what those requirements are for the insurance, And we can also obtain a response for any submitted resource that the healthcare providers want to submit or the patient is inquiring about. AstraZeneca's Access 360 can also look at pharmacy research and coordination. This may be a combination of in-house provider dispensing. Your physician may have the pharmacy. We could look at how you as a patient could get access to drug, as well as specialty distributors, outside specialty pharmacies, or any of the combinations thereof. There's also follow-up support. So Access 360 can help patients with select AstraZeneca medicines to get it in a timely manner. And of course, with the insurance payer landscape, claims appeal support is a process also that Access 360 can offer to help with insurance appeals requirements and obtain a response in a compliant manner. So those support resources I talked about, all these can be found at myaccess360.com. So this is a website you want to remember because it is here where a repository of information and resources can be found. So that's myaccess360.com. Now let's take a look at the affordability support. So at AstraZeneca, our commitment to affordability access resides within 1 to 2 programs. Both of these programs attest to our goal of making sure that we are removing the cost as a barrier to patients for gaining access to our necessary AstraZeneca medicine. One program is AZ&Me Prescription Savings Program. Another name for it could be patient assistance. This program helps qualified patients. Support options are exhausted and assistance is still needed. This program comes into play. The other program is Patient Savings Program, also called Copay Savings. This helps qualified commercially insured patients and monthly out-of-pocket costs are helped. Let's take a high-level overview. We're going to start first with AZ&Me Prescription Program. This prescription program is for those patients that are without health insurance. It is also, eligibility is based on qualifying income requirements. Typically is at the federal poverty level with AstraZeneca, we're at 500%. Also looks at Medicare Part B and Part D patients where they still may have high out-of-pocket costs. Also, there may be opportunities where AZ&Me can help out with commercially insured patients where the patient is actually having their drug covered, but they still have a high pocket cost. Now let's take a look at the Patient Savings Program, which is also the Copay Program. Copay program are for those patients that have commercially health insurance. They have to be residents of the U.S. and Puerto Rico, and the medication has to be covered under their commercial health insurance. But maybe the full cost is not being able to be paid by the patient where they need assistance. These particular patients cannot have any state or federally funded programs, including but not limited to Medicare Part B, Part D, any DoD coverage, VA coverage, TRICARE, or even Medicaid. These patients are actually received an out-of-pocket assistance for up to $26,000 per year. So in a lot of cases, the patients will only have to pay $0 for their copay, which is awesome in as far as affordability and access to our medications. Now, as I promised, I wanted to give you the contact information for Access 360. It's 844-ASK-A360 or 275-2360. Of course, you can also go to AstraZeneca-SpecialtySavings.com for a lot of our specialty savings program and support for affordability. Thank you so much for listening today. I hope this was helpful. I hope it provided some insight, and I hope it led to our commitment to make sure that patients have access to our medications. Thank you.
Hi, everyone. I want to start by telling you a little bit about Triage Cancer and the resources that we provide to help you manage and avoid the financial fallout of a cancer diagnosis. So Triage Cancer is a national nonprofit organization that provides education on all of the practical and legal issues that might come up as a result of a diagnosis. And those issues are across the gamut. So we have a page of resources that are organized by topic on our website, and they range from things like navigating employment to understanding the rights of caregivers in the workplace. So we provide free education in a variety of different ways. We host free educational events. We have a couple of educational events that are coming up that really focus on navigating the financial fallout of a cancer diagnosis, including our triage cancer conferences in October and November. And we have a webinar on October 20th on how to choose and use your health insurance effectively. We also provide free educational materials and even animated videos on some of these topics to help people navigate these issues. And because where you live matters, we have state-specific resources and a chart of state laws available on our website, so you can find the information that is specific to you. We also host a separate website called cancerfinances.org, which provides education on a variety of different topics that can impact your financial situation and then connect you to financial assistance resources. And what is unique about this site is that you can pick a topic, you can answer some questions about your specific situation or what you're looking for, and it will tailor the content based on how you've answered those questions. So you can get the information that's most relevant to you. Now, financial toxicity is a relatively new term coined by some researchers from Duke back in 2013 that described the financial challenges that can come with a cancer diagnosis. But even though it's a relatively new term, it's not really a new problem. And part of the challenge in addressing financial toxicity is that there are so many contributors to it. So we think the largest contributor to financial toxicity is having adequate health insurance coverage and making sure you're minimizing your out-of-pocket costs. But there are other things that can impact your financial situation, like whether or not you have to stop working or take time off for a short period of time can impact your income. And then there are all those life changes that can also have an impact on your financial situation, like getting married or graduating from school. So Triage Cancer offers this quick guide to avoiding financial toxicity. And this is just a visual representation of that quick guide, where it lists all the potential questions that you should be thinking about or getting answers to help you manage your finances after a cancer diagnosis. And the quick guide that you can find on our website not only lists the questions that you need to be thinking about, but also lists all of the resources that we provide at Triage Cancer to help you answer those questions. So we want you to know what resources can be available to you. Now, I mentioned that having adequate health insurance coverage is probably the primary way that we can reduce someone's financial burden of a cancer diagnosis. And we have a large number of resources available to help people navigate health insurance. I often say that there should be a class in high school on health insurance because it's one of those things that everybody should have and should know about, but who actually teaches us about health insurance? If we're lucky, we get our first job and someone hands us some paperwork and we have to try to figure it out and make educated choices. So we have a huge number of resources to help people navigate health insurance, including an animated video that talks about key terms that you need to understand, as well as how to pick a health insurance plan with the lowest out-of-pocket costs. And I'm going to give you an example of that in just a few minutes. So when you're talking about health insurance, it's really important that you're a savvy consumer. And we didn't used to have a lot of options related to health insurance. Because now we have those consumer protections that protect us if we have a pre-existing condition, we have some more responsibility as consumers. So we need to understand what those consumer rights are, like understanding what coverage you are entitled to, but also what you have to pay out of pocket for certain types of coverage. And if an insurance company denies coverage for something, don't take no for an answer. Understand your appeal rights, both inside the insurance company and outside the insurance company. And we have a lot of resources to help you understand those consumer rights. But also, even if you think that you have great health insurance coverage this year, it's incredibly important to actually review your options every single year, because you can see whether or not there are better options that maybe have better coverage of your providers or your prescription drugs, but also there might be lower costs involved. So it's worth taking a look every single year just to check if there's something out there that's better for you. Now, I want to walk you through a quick exercise on how to actually figure out which plan actually has the lowest out-of-pocket costs and will cost you less by the end of the year. So these are 3 plan options, and this bronze plan is a plan with $173 monthly premium, but has a $6,000 deductible and a $6,000 out-of-pocket maximum. The silver plan is a $271 premium, but has a $2,500 deductible and a $5,200 out-of-pocket maximum. And the platinum plan's monthly premium is $398 a month with a $0 deductible and an $1,150 out-of-pocket maximum. So the question is, can you tell just by looking at these options which plan is actually going to cost you the most by the end of the year, assuming that you're going to hit your out-of-pocket maximum? Because most of the time when we're talking about cancer care, you're going to hit your out-of-pocket maximum. So the answer is you can't tell just by looking at them. You actually have to do the math. And the way that you do the math is that you take the monthly premium and you multiply it by 12. And then you add that to the out-of-pocket maximum. So in looking at these plan options, it turns out that the plan with the most expensive monthly premium actually ends up saving you more than $2,000 by the end of the year. And this is really about understanding how out-of-pocket maximums work and how you need to do the math on all the plan options that you have available to you to really understand what the true cost is going to be. And this is different with every plan example we use. It's not always the platinum plan. Sometimes it's the bronze level plan that's cheapest. But the point is that whatever your options are, you should do the math. But it isn't just about the total cost by the end of the year. You also need to make sure that any plans that you're looking at actually cover the providers and the hospitals that you are going to and the prescription drugs that you're taking. So when we're talking about employment rights, there are actually laws that provide you with benefits and protect you in the workplace and help you decide if you want to work through treatment, take time off, or return to work. And those laws include fair employment laws, which protect people against discrimination and give them access to reasonable accommodations. And those laws exist both at the federal level, like the ADA, as well as at the state level. And then there are laws that we refer to as leave laws, which allow people to take time off work and get access to job protection and sometimes even health insurance protection. And if you work under an employment contract, that contract can actually provide you with additional information about your benefits and rights in the workplace. So we often forget that the law just provides a bare minimum of what employers have to do. There are so many employers that go above and beyond that bare minimum. So looking specifically at your employer's policies about whether or not you have access to certain benefits like health insurance or life insurance, if you have access to specific time off policies like sick days or vacation time, or maybe your coworkers can donate their leave time to you. Those things are all going to be specific to your employer. And so looking at those employer policies is critical. Now, I mentioned the ADA and access to reasonable accommodations. And these reasonable accommodations are any change in your workplace or in policies that allow you to be able to continue to do your job or to return to work. And those can take lots of different forms. These are just some examples. But I think this is probably the most underutilized tool that the law provides to help someone stay at work and maintain their income if they need to, or if you want to. There are lots of people who actually want to work. So this is the legal protection that allows you to continue to do this. Now, there are also state laws that allow you to actually take time off, and we refer to these as leave laws, and they are kind of all over the place. So it could just be sick days that are required by your state, but it might even be at the county or city level that you have access to these additional protections. And these are just some examples of the ones that exist out there. This is information that we track on our chart of state laws. But when we're talking about taking time off under federal law, we're really talking about the Family and Medical Leave Act, or the FMLA. And this law gives you up to 12 weeks of leave per year, either to take time off for your own serious medical condition or as a caregiver of a spouse, a parent, or a child. And we have a lot of information about the FMLA because the FMLA is the primary tool that protects your job if you want to take time off, and protects your health insurance coverage if you get your health insurance coverage through your employer. Now, if you are taking time off for your own serious medical condition, laws like the Family and Medical Leave Act are unpaid. So how do you replace those lost wages? And disability insurance is the primary way to do that. And there are lots of different types of disability insurance. There are short-term policies or long-term policies. You can buy policies directly from an insurance company, but most people get access to a private disability insurance policy as an employee benefit through their employer. So lots of people tell me that they don't have disability insurance, and I send them back to their employee manual, and it turns out that they do, because it was just a piece of paper that they signed on their first day of work. And then they forgot all about it because their employer paid the premiums. So it's worth double checking to see if this is something available to you. And then a handful of states also provide state disability insurance, which is a short-term plan that lasts up to a year. And then there's the federal long-term disability programs, which are for individuals who have a medical condition that is expected to last at least a year or longer. And those include Social Security Disability Insurance, which is SSDI, and Supplemental Security Income, which is SSI. Now, for caregivers who are needing to take time off work to care for someone, there are some limited options for wage replacement. There are a handful of states that provide paid leave for caregivers who need to take time off work. But if you are eligible for Medicaid in your state may offer a program where your family members can actually get paid as your caregiver. So it's worth taking a look to see if this is a program that's available to you in your state. And it's included in the information on our state resources and state laws page, as well as our caregiving module on cancerfinances.org. So these are just some highlights of the programs and resources that are available to help you navigate the financial fallout of a cancer diagnosis.
Hello, thank you for that introduction. As was said, I'm here today to talk about some different patient tips while dealing with insurance, any of the financial issues that may come about during your cancer journey, or if you're an advocate helping someone going through their cancer journey. So this first slide is just some high-level things that I'll kind of go into as the presentation continues. So if the amount on your bill that you get from your provider, so either the hospital or the physician's office, seems too high, never just pay it. It's always good to review and question the information that is coming to you through your EOB or through the statement from your hospital. It's important to match your EOB from your insurance company, your explanation of benefits, with the statement from the hospital or provider's office to make sure that they match. Don't panic if you see the word denial written on your EOB. There are things that we can do that we're going to talk about today that we can do to help you if you see that word. And then most importantly, it's important that you know your benefits. That means knowing your copays, your coinsurance deductible, and your out-of-pocket maximum. So I just wanted to start with a high-level understanding of these three terms that we all hear passed around. coinsurance, copay, and deductible. It's important for you as a patient or as an advocate to know what these mean. So a coinsurance is a fixed percentage. So an example, 20%, sometimes you'll see 10 or 15 of the cost of every medical service you receive. A copay is a fixed amount for particular services. So often you'll see an office visit is $20 or $25, where an emergency room copay may be $100, or maybe you have a specialist that's $50. So that's going to be in your benefits with your insurance company. And then a deductible is the annual amount of money that you'll pay for your insurance out of pocket before the insurance picks up the rest of the costs. But one thing that's important to note is that copays often are not part of a deductible, and actually, but can count towards your out-of-pocket maximum. So it's important for you to know if your copays count in your deductible or not. I'll say that the majority of the time, they will not. So one thing I really wanted to focus on today was how to read your explanation of benefits, or EOB, from your insurance company. I've been in a lot of conversations with many of you, with many other patients here at the university and elsewhere about what does this document that I'm getting from my insurance company actually mean. So there are 4 different codes here that explain who's responsible for the money on the EOB. And I will show you an example here in an upcoming slide. But when you see a CO, that means contractual obligation. So that's used when there's a contractual agreement between the payer and the payee, so you as the patient, or it's some sort of regulatory requirement. OA means other adjustment. So it means it's not your responsibility. Either as a CO, it's not your responsibility. Same with a PI, not your responsibility. The one that you need to pay attention to is PR, which stands for patient responsibility. So you'll often see this tying to a copay, deductible, or if there is a denial that needs your attention as a patient, it will say this on there as well. So on this screen, you're just going to see a snippet of numbers. So the first part of the EOB will have those letters, and then the second part will have these numbers, and it will tell you what these numbers tell you what it means. So you'll see that 1 is deductible, 2 is coinsurance, 3 is copay. So those are all things that you would typically see, and those are your responsibility. But then you'll see these other numbers are going to fall in categories that really you as a patient have nothing to do with and need to worry about. Here's an example of an EOB. This is something that you would get in the mail, or if you get them electronically, you may get them in your email from your insurance company. That's letting you know, telling you what's going on with your claim and with your bill. And you can see I've outlined some of these boxes here. There's this box in the right-hand, upper corner. It says CO16. So if you remember from the previous slide, CO means contractual obligation. So that means that this is on the provider. This is nothing to do with you. So what you would need to make sure to look at is those patient responsibility boxes only. So oftentimes, so in this example, I'll say CO16 means claim lacks information. So if you were to get this, you would say, what information is lacking, and kind of maybe have a panic. It's denying my claim. They're not paying it. What does this mean? I would say 99% of the time, there is someone at that institution, at that provider's office that's already gotten this, and they are well on their way on getting that information to the insurance carrier to take care of this for you. Sometimes, I hate to say this, sometimes it takes a few weeks to work those, all the way to a year to work these. I worked inpatient financial services on the back end of this, on the denial management side for 10 years. And we had, I'm not even joking you, hundreds of people in the background working these for you. So they are actively working these denials. And ultimately, if you see something that says CO like that, and they can't get it overturned, you are still not responsible. The institution would have to take a write-off. So if you see a denial like this, please do not worry. However, if you see something that says that PR or says patient responsibility, that's when maybe you need to get involved. So there are certain circumstances where the institution could appeal this for you, or they can assist you in the appeal with the insurance company. But there are some times where the insurance company needs a piece of information they can only get from you. So maybe they are there's some sort of error with their birth date, or there's some sort of signature they need from you that they can't process your claims until they get that information. So if you see something like that that says you're fully responsible, you should call the institutions, the hospital, the physician, the provider's office, and find out if they need anything from you. And then if they don't, ask them how you can get this claim paid. And they'll often provide you with the documentation. Sometimes they'll even help you write it. There are limitations from a provider's office of what they can appeal when it is a patient denial. So they are really walking a thin line, but they are always there to help you. And finally, I just want to say, just call and ask. Never assume you have to pay a whole bill when you get those denials. Never. Always call first. Always double check to make sure it's matching with your EOB and your statement are matching. And also, again, when you get that explanation of benefits from your insurance company and you see a denial, do not freak out. Do not worry. Chances are someone is already working it for you. They're already hot on the trail. They're going to fix it. But if they need your help, just make sure you are in contact with them, getting them any information that they need. But there are lots of resources at different facilities and at your doctor's office of people who their whole job is just to work on this kind of thing. So there's almost always a way to get these overturned and paid. So my recommendation is to work with your hospital and also work with your insurance carrier. This is a collaboration. We want to make sure that the information that everybody needs is getting to the right parties. If you have any other follow-up questions for me, I've worked with many of you before in the past on your EOBs and understanding your insurance. I am an open book and would love to answer any questions that you may have for me. Thank you.